Welcome to the Autism in Black podcast, where we focus on all things autism and the Black parent experience. Our goal is to always educate, support, and empower parents to advocate for not only their children, but themselves. Hello, and welcome to the Autism in Black podcast. I'm Maria Davis-Pierre, a licensed mental health counselor in the state of Florida and America's #1 autism advocate for Black parents. I am the founder and CEO of Autism in Black, Inc., where we aim to include the excluded. Today we have Carmen Jimenez Pride, who is a master's level social worker, substance abuse professional, licensed clinical social worker in North Carolina and Georgia. Carmen is also a registered play therapist supervisor, credentialed by the Association of Play Therapy. She earned a master's of social work in 2005 with a focus on communities and organizations from the University of South Carolina. Carmen has over 17 years of experience in the mental health field. With a focus on children in play therapy, Carmen is the founder of Play Therapy with Carmen, Inc., an organization dedicated to educating the mental health community on play therapy and providing supervision, training, and resources for licensed professionals. And Carmen is the creator of Focus on Feelings, a play therapy curriculum focused on social and emotional development. This week is actually National Play Therapy Week, so what better way to celebrate than with an episode that focuses on play therapy and the benefits of receiving play therapy. Enjoy today's episode. Hi, everybody, and welcome back to another episode of the Autism in Black podcast. We have a very special guest today. I know her personally, and she is a very good friend of mine. We have Carmen here today.
Hello, hello.
So I have already read your bio and we know a little bit about you, but could you tell us some more that we don't know?
Well, probably you've already said that I'm a registered play therapist. I have a private practice in Augusta, Georgia. I'm licensed across 3 states, and I do a lot of trainings in those states in reference to play therapy and for beginner social workers. I'm an author. I'm a creator, and I like playing. So like playing. So that's basically me.
Okay. So can you tell us a little bit about what play therapy is?
So I'm going to tell you the definition of play therapy from the Association for Play Therapy, and then I'm going to break it down and give you my definition of what play therapy is. APT, which is the Association for Play Therapy, says that play therapy is a systematic use of a theoretical model to establish an interpersonal process wherein trained play practitioners use the therapeutic powers of play to help clients prevent or resolve psychosocial difficulties and achieve optimal growth and development. Me personally, I cannot say that to my parents and them get what play therapy is, right? Mm-hmm. So basically, I tell my families that it's a modality that I use to treat trauma, cognitive behavioral issues, and emotional challenges. And still, some of my parents are like, what? And then I break it down. I play with your kids and we address the issues that you came in with. And they're like, oh, okay, I got it. I got it.
Yes. And when you say you're sitting there playing with them, what does that look like? So for a parent who doesn't know anything about play therapy and they're like, how is this going to be helpful to my child? Just you sitting there playing with them. How does the therapeutic aspect come into play?
Well, basically everything that I do as a registered play therapist in any intervention that I use, whether it's like the classic game of checkers, there's a therapeutic piece to that. So say that every time that you land on a certain number on the checkerboard, which of course I, pre-write those numbers, you have to tell me something good about your family. So that is an activity where we're building rapport. Say that we use a Jenga game, and every time they pull a certain color, they have to tell me something happy, something that makes them happy or something that makes them sad. Now we're starting to deal with, of course, the feelings piece and then the things that they experience. I'm using common things sometimes that parents see constantly every day to help the kids reach their goals. A part of that is me bringing them in my playroom and showing them everything that I have and letting them ask questions. Well, what do you use this game for? Or what is this bear for? And I'm able to explain that to them and they get a better understanding of what play therapy is.
Perfect. So how would a parent who has a child who is autistic, how could this benefit them? Or is there a certain type of play therapy that would benefit a child who is autistic?
Well, there is a play therapy modality called AutPlay, and that was developed by Dr. Robert Jason Grant. And basically what that is a play therapy model and behavior therapy model basically coming together and helping children that are on the autism spectrum. And other children dealing with neurodevelopmental disorders and other developmental disabilities. And basically what it is the primary focus is children with autism, AutPlay. So where what's considered your normal child will come in with trauma, a child with autism might not have trauma. They might have issues surrounding social and emotional interacting and connecting and things like that. And that's what AutPlay does. Help those kids that have those additional issues versus like traditional play therapy.
Okay. Now, what if the child who is autistic is dealing with trauma? Would AutPlay be beneficial to them?
Definitely. It just really depends on the child's level of functioning. Some of the basis of AutPlay is your traditional play therapy, just a cut and paste from different models, like the foundation of it. So you still have your traditional play therapy. It's more directive than child-centered play therapy, but it's the family therapy piece. Like I utilize internal family systems, and that helps with trauma. I can use that in the AutPlay sessions as well. So it's combining other therapeutic approaches, but really diving in and focusing on kids with autism.
Okay. And for a parent who finds a therapist who specializes in AutPlay and they begin this type of therapy, what kind of benefits should they expect to see?
Increase on emotional regulation, social functioning, connection, behavioral changes, anxiety reduction. It's utilized the follow me technique where when a child first comes in, like the child has like free reign over the playroom and the clinician is following the child. So, and every time that we have a session, I'm looking for opportunities to engage the child. And that might take a period of time. Some kids are going to be quicker to engage with me, some are not. So the parents can watch this, or I'm definitely giving reports back to the parent and let the parent know, well, the child was interested in Legos. So now becomes the parent-led part. When they get home, they're doing the same interventions that I'm doing within session. So we don't get to any interventions, and it's just the follow me approach where I'm just following the child, being engaging, having the communication with them, giving them the eye contact, being present. I request a parent to do the same thing. So the kid is getting the intervention in the playroom, and they're also getting the same thing within the home setting. And with being consistent with that and developing that structure and that foundation, they're going to see differences in the interactions with their children.
Perfect. So a parent can be involved in these sessions.
Oh, that is highly recommended. So it's not one of those therapy models that you can drop your kid off and go run some errands. Mm-hmm. Definitely not. When I work with a kid and utilizing AutPlay, it's mandatory for the parent to remain in the office because they're able to watch what I'm doing. And then if the child has an issue, I can get the parents right there, that they can come in. And a lot of times my parents just sit in on the sessions as well. So we're both engaging the child. And then I'm able to back off and kind of direct the parent on what to do. So it's definitely a practitioner and parent-led model.
I love that, because a lot of times, like you said, that a consistency needs to happen not only in the therapy setting, but also at home. That way the child has a consistency and they're able to know that this is just not for this setting, but at home as well. And it makes it easier for them as well.
Exactly.
What about school setting? Do you provide these services in the school setting as well?
Well, the school setting gets kind of tricky. It depends on the school. So if it's worked in, the intervention is worked into like an IEP or any other behavioral plan that the school might provide, then the therapist can go in and do that.
Okay.
It makes it kind of difficult when it's an outside clinician coming into the school and it's not the traditional services that the school is used to. So we kind of have to fight for that. Okay. And that puts, of course, additional pressure on the parents to fight for services. And I know that's always a big thing for parents dealing with the school when their child has autism. But anyone that's trained in AutPlay, play therapy, they advocate. So that's something that I, help my families with when it comes down to the school.
Okay. Is there a age limit to those who can receive AutPlay therapy?
I say no, because you might have someone that's 17 and they're operating on a younger level, so they can benefit from the interventions that we're doing within the playroom, as well as a 6-year-old. So I say that there's no age limit. And even in training, we wasn't trained on an age limit. It's just the limit on functioning.
Okay. And what about a 17-year-old who is operating at the level of a 17-year-old? Would they still benefit from AutPlay therapy?
Definitely. If they can have issues with controlling their emotions, they can have anxiety, and just sitting down and talking to them is not efficient. So coming in and having play therapy and AutPlay will be more beneficial to them. They're going to get more. Their skills are going to increase. So definitely.
And I know you mentioned you have a lot of products and a line, and I know one in particular that I have used with Malia that has helped her is your Focus on Feelings line. Can you tell us how you use that, and also tell us what that line is?
So Focus on Feelings is a multicultural set of products that is geared to helping kids understand their feelings, increasing communication, and improving their social and emotional development. So it starts off with, there's a poster that has 10 faces and emotions. I stuck with 10 because that's easy to grasp. And to me, those are the 10 that kids really present having issues with understanding. So it's teaching them those 10 feelings with the poster, the books, the flashcards. There's a cling board, there's a journal. So it's a full line of things that can be just keep reiterating these feelings with the goal of them learning them instead of demonstrating how they feel with aggression and things like that. They're able to verbalize it. And when they're able to verbalize it, of course, that's increasing their communication skills, and it's also helping them interact with people socially. And they're able to express their feelings.
Okay. Now, is this line only for therapists, or can parents use it as well?
Definitely for parents. Anything that I create with the mind frame of it's not just for clinicians. A clinician can pick it up and utilize it. A teacher can pick it up and utilize it. And a parent or caregiver can pick it up and utilize it and have just as much as benefits across the board.
Okay. Can you give a few examples of how a parent can use your line? So if they go and purchase, which I'm encouraging you all to do because it's so helpful, they would know how to begin using it with their child.
So 2 of the biggest products that I would say is the must-have is definitely the Focus on Feelings book, Learning About My Feelings. The book is broke down really easy to use. One page is the feelings face, and then on the opposite side is the definition of the feeling. But what drives it home is there's an example of it with character names and things like that. So it, like say, sad. You have the face, you have the definition, and then you have an example of that. So kids are able to get it in like a story form. And then the poster, you can put the poster on your refrigerator, in their room. If you have a command center in your home, you can put it there. And that's for the kids to be able to constantly see it. So they're hearing about the feeling, and now they're able to see the feeling. And you can use I feel statements. How do you feel today? Go point at it, because kids with autism are very visual.
Yeah.
So they're not just going to say, I feel frustrated. No, they can go and they can point at frustrated.
Mm-hmm. And this is also very helpful for some of our children who are non-speaking as well. It gives them another way to communicate their feelings by being able to point to the faces and say that, this is what they're feeling by pointing to it.
Exactly. And it's an interactive thing. Like, you have your poster and you can sit down and teach your kids these feelings. You can get them to draw their version of the feeling. So they can mirror what they're seeing on the poster. You can make the faces with them. You have it on paper. So it's just constantly reiterating these 10 feelings so the kids can get it and they can start using it, whether it's pointing or whether it's verbally saying, this is how I feel.
I love that. And then another one of your products that I am a champion for is Amir's Brave Adventure. Can you tell us about the book?
Definitely. Now, this is one of my favorite. Now, I love my focus on feelings, but I love Amir so much because he's so cute.
Me too.
Amir basically is a multi-sensory book that helps bridge together imagination, touch, sound, visual, and mindfulness. Mm-hmm. The story is about Amir, who is a leopard cub, and he's different from the other leopards. He doesn't have any spots. So that's right there already talking about differences in kids. Mm-hmm. And throughout the story, like I said, it has a couple of different approaches. You're talking about him being brave, him being confident, and him being calm, which is the mindfulness piece. But it also gives the kinesthetic storytelling part, which is backstories. So throughout the story, there's going to be certain words that are written in purple. And at the bottom of the book, it gives a hand motion that you can do the backstory. So that's where the touch come in. So the kids are not only hearing it, they're feeling the story as well. So example, one of the words is calm. So every time you read calm in the story, you can spell that on their back. And if kids don't like that on the back, you can spell it on their hands. So they can really feel the story. Okay, that's calm. Another one is confident, of course, brave. And we do symbols like grass, and you draw the grass on their backs. So again, they're hearing the story and they're able to feel the story as well. So that increases that bonding between the parent and the child.
I love that. And it also helps with emotional regulation as well, with the calming factors and things like that.
Yeah, one of the biggest concepts of the book is Amir's mantra, which is I am calm, I am confident, and I am brave. So we're pushing them to be calm and confident and brave, but we're also teaching that mindfulness technique. Okay, stand strong and take in a deep breath, and I am calm. Taking a deep breath, I am confident. Take a deep breath, I am brave. So the directive could be, you're at school, you're having some trouble, you don't understand what you're reading. So instead of escalating, think about Amir. What would Amir do? Oh, Amir will be calm. He'll be brave. He'll be confident. And there's the breath, and that's that regulation right there for them to kind of reset.
I love that. And I will have in the show notes everywhere you can get Carmen's products, as well as everything else she's talked about today. Do you have any resources that you recommend for parents or caregivers or healthcare professionals that may be listening to gain more information about AutPlay, play therapy, and resources that they can look into to see this mode of therapy? Because a lot of times parents, we only hear about ABA therapy, but there are so many more types of therapies out there for your children that may be beneficial as well.
Definitely a lot of good information is going to be on the main pages for AutPlay therapy and for the Association for Play Therapy. I have a lot of information on my page, which is carmenprod.com. Just those main pages will give you a bulk of information. And what I like about both pages, the AutPlay website and the APT website, that you can search for practitioners. So everyone on the website will be trained and certified in AutPlay and play therapy.
Okay, I love that. And do you have any advice for parents or caregivers who are starting to look for play therapy as an option for their child?
My biggest advice is make sure that the individual is trained and they're certified. A lot of people don't care about that fact, but I'm a big pusher of that, because if they are trained from the Association from Play Therapy, that means they met the requirements to hold a credential as a registered play therapist. Mm-hmm. And I tell my parents all the time, or just not even my parents, but people that call and ask about my services, they're looking at Psychology Today. That's one of the go-to for services. And when you create a Psychology Today profile, you can check whatever you want on there. And a lot of clinicians check play therapy, and they might be doing play therapy. That's great. There's a lot of clinicians that have not done the credential, but there's a lot that has. So definitely just check their references, check their certifications, make sure their names are listed on these other websites to make sure that the person is trained in what you need for your child. And don't be afraid to ask those questions. I don't get offended when someone calls me and say, hey, my son or daughter has autism. Are you trained and certified to work with them? And I say, yes. And they're like, well, prove it. Okay, no problem. Because people are trusting me with their kids, and that's important to me, because I'm developing a relationship not only with the child, but with the parent. And 9 times out of 10, when they get to me, they're frustrated and they're just looking for services, and they've been looking for a while. Mm-hmm. So I want to make sure I give them all of me and the professional me.
Yes, I love that. Love that. So as we wrap up, where can those listening find you?
So I'm across all social media platforms with the same tagline, which is Pride, Pride, LCSW. Facebook, Instagram, Twitter. My main website is carmenpride.com, and my resource store is playtherapywithcarmen.com.
Perfect. Thank you so much. I just want to thank Carmen for giving us information about play therapy, AutPlay, and then how we can use her products as well when we are working with our children, as it's so important. So thank you, Carmen, for being on the show today.
Thank you for having me. Thank you.
And thank you all for listening. I will catch you on the next episode. If you haven't done so, make sure to subscribe to our podcast so you can always be notified when a new episode drops. To get the resources shared on today's podcast and the show notes, make sure to go to autisminblack.org/podcast. And be sure to share your takeaways from the show on IG Stories and Twitter using our official hashtag AIBPod so that we can find them and share them. And if you want to continue the conversation from today's episode, make sure to join our Autism in Black podcast Facebook community. And please make sure to answer the questions to gain entry. Thank you for listening and joining me this week. Have a good one.